Good evening, everybody. I'm Dr. Joseph Baker from the Limber Chiropractic Center, and I got a question for you. How many pairs of shoes do you own? Now, I asked that question to a patient earlier today, and right away, he looked at me and he goes, I got 3 pairs of shoes. I got a pair of work boots, I got a pair of sneakers, and I got my Jesus sandals. I got 3. And he knew exactly how many pairs of shoes he had. Now I'm thinking, I got a few more pairs than that. And probably you're out there and you're starting to count through your closet and thinking, well, I definitely got more pairs of shoes than that. I keep old sneakers, so I got a lot of those, and I got cycling shoes, and I got running shoes, and then I got, boots and my dress shoes. And well, here's the thing. What would it be worth to know how to choose the proper pair of shoes that would help you stabilize your spine more? Now, the real question is that the most important thing? The answer is no. See, because in the end, it's not the shoe. In the end, it's not about what that outside wardrobe looks like. In the end, it's about knowing how your feet are positioned. And as the foundation of your spine, that is the absolute most important thing. So tonight we're going to step into, no pun intended, talking about your feet. We're going to talk about some things that, you're probably aware of. There are going to be some things I definitely know we're going to be bringing to the table tonight that you've probably never heard of before. And in fact, just like I shared earlier today with some patients, we're going to be talking about some new technology that you're going to be seeing that is going to help address foot and ankle issues. And I'm really excited for it because it's one of those things that is going to be that thing that helps to unlock so many people from having their dogs talking to them by the end of the day. So let's step into this and let's talk about this just a little bit. And the first thing is how important are your feet? Pretty darn important. In the Army, you got 1 pair of boots, you got a couple pair of socks, and they always told you keep your feet dry. All right? Because when your feet are uncomfortable, when your toes are not feeling the love, what ends up happening is not one part of your body is going to be really happy. And likewise, for the setup as far as the function or the mechanics, it's exactly that same way. It's the thing that is going to affect every single part of your body. In fact, a couple weeks ago, we did a workshop on just the big toe. That's it. Just that one single thing, just that big toe. And we talked about how that big toe affected so many other parts of the body. In fact, everything from headaches to TMJ problems to knee pain and foot and ankle issues could be affected by that big toe. How important is it? It is. It's the foundation of this body of ours. We have to use it every single day. In fact, for so many of you, I bet you right now you're looking at your watch. You're looking at how many steps did I get in today? Oh, well, we never get away from using it. And unfortunately, because gravity is constantly pushing down on us, those arches in our feet have to constantly be pushing force into the ground, trying to keep it away from being absorbed by the body itself. So, is it important? Absolutely. In fact, this little diagram here, I love this. It helps to give us that visual, that picture, that understanding of how, one little thing, like, the arch breaking down in your foot is capable of affecting the alignment of your knee and your hip, and then twisting your pelvis around, twisting that low back where you have to continue to try and compensate. And then finally in the shoulders, we see how you can't compensate by one shoulder being higher than the other. And listen, it's uncomfortable for me even standing here like this. And yet, I know there's some of you out there, and there's some of you who you have friends and you have family members that are exactly like this picture. This is that picture that you probably saw when you looked at your posture tech when you first started at the Limerick Chiropractic Center. In fact, let me just remind you, because this workshop, like all of our workshops, are not options for our patients. If you're a patient, this is part of the educational process, part of the process to help you stop doing some of the bad things that are acting as an anchor to keep you where you're at, and they're helping to unlock you and giving you those really good tools to be able to move forward quickly and not fall and stumble again and end up back to where you were the first time. I love the fact that we get to learn something new every single week. But here's the thing. I want to hear from you. I want to hear what your takeaway was. What's that thing that maybe, you know what, as you're thinking about your feet, you know, Doc, I remember us talking about it in the beginning. Are my orthotics okay? Do my inserts still work? Do I need to make sure that my children get checked? Because, well, listen, they not only look like me on the outside as far as my appearance, but same with their other features. Do I need to make sure that they get checked? I want to hear from you in the comments section. Leave me those comments. Now, the third thing, you need to make sure that you're sharing this information. There's a lot of people out there that they're never going to hear about the effect that their feet has on the body unless you share it with them. Because as we learn, we have that knowledge, that information, the power of making better choices. Well, I want to share that power with others so that they too can make the other choices to help themselves live a more vibrant life. Because, listen, in the end, nobody is saved from foot problems. And if you think, you know what, it's not going to affect me. Ladies, let me tell you, you're the first on the chopping block. Pregnancy, step number one. Unfortunately, pregnancy is one of those things that causes a shift in your estrogen and progesterone ratio. That relaxin hormone causes everything to get loose, and guess what? Your feet want to flatten out more during your pregnancy. Oh, let's dial forward a couple years, you know, those menopause years. You know, that shift, unfortunately, that continues over 10-year span of time. That's why you get introduced to those black boat shoes. I love those. My grandmother used to wear them. Oh, they looked like they came out of some sick army hospital, you know, shelf. They were just horrible looking. And yet, people accept the fact that, well, I'm just going to have to move to my feet getting wider and wider, when that's not the case. You know, oh, and yeah, by the way, we sort of forgot that whole little thing of high heel shoes, you know, whether they are pumps or heels or whatever you want to call them, you know, putting you in that really bad position, destroying your feet, you know. And guys, listen, we're no different. We're doing Dumb and Dumber in our sneakers if we're not picking the right shoes for what we're going to be doing. None of us are exempt. So you know what? This is one of those things that as we come to recognize we're all in this boat together. And if we're not stabilizing the body from the feet up, well then we're just accepting what we see here. And to me, that's not okay. What you see on green on the far end, that's what we want. We want everything to be nice and balanced so that in the end, that our body is able to communicate and function at that optimal level. There is no way that if you look like what is in red, that your body can function at an optimal level the way it's supposed to be. So the question is how can I get help? How am I able to make sure that not only am I helping myself, but I can help others in the process? Well, the very first thing is get checked. Many of you have been scanned. If you're a patient here in our office, listen, getting checked is simple, it's easy, it's painless. That foot scan takes all of about 2 minutes in order to complete. In the end, we get that accurate picture of what's occurring in your feet as you are weight bearing. Yes, let me say that again, weight bearing. You don't live your life laying on your back. You don't live your life hanging upside down. So guess what? We need to see what effect gravity has on you. And therefore, as you're standing on that platform, that picture of the pressure is being generated that helps us better understand how the tissues are being supported, or how are they being broken down. So the first thing is get checked, you know. The second thing is, yeah, sometimes we need to use some things in order to help to support the feet the way they're supposed to be. So Kinesio Tape happens to be one of those things. It's really great. It helps to support the feet if in fact there has been damages, so it relieves stress and pressure on a certain section or part of the muscles that control your feet. The wonderful thing is it's very capable of temporarily reducing stress and pressure, which oftentimes produces pain. And the wonderful thing is that this stuff can get wet. This stuff is designed to be used for short periods of time, and particularly for, if in fact your body is in distress, helping to temporarily dial back some of the mechanical inflammation that's producing why you feel the way you do. Isn't it great that there's options out there? That in the end, the worst thing that happens is, let me think, you might lose a little bit of hair pulling this tape off. That's the worst thing. We're not going to be talking about chemicals. We're not going to be talking about injections. We're not going to be talking about things that either put products into your body that are toxins, or removing body parts that are going to be, well, unfortunately, lost and never ever going to be able to be replaced again. I want to make sure that any of these options that we're going to talk about are things that you're capable of doing and coming back and still being whole. So the next thing happens to be what's called cold laser therapy. Really, really cool. We've been using this for a number of years. This application, this particular device, it's been around for about 40, 50 years. The wonderful thing is that, it produces endorphins and enkindins into the tissue. In other words, it kills the pain, removes the inflammation. It also allows for the tissues to turn over more rapidly, so they're able to enter the healing process more quickly because of it. With the feet, oftentimes things like neuropathy, plantar fasciitis, heel spurs, a lot of different conditions, including a Morton's neuroma. We oftentimes use a cold laser. Wonderful. It's a fantastic means by which you're capable of helping the feet function better. Now, I promised you we were going to go over some new technology, some new things that are capable of being used. And this is one in which this is a mechanical means by which we're capable of affecting the function within the feet. How it is that you're capable of helping to repair tissues that have been damaged. Because let's be honest, for some of you, you've been walking around with problems, not for years, but for decades. Hence the reason, some of you who have had things like Achilles tendonitis and plantar fasciitis, different types of ankle sprains and breakdowns, it's left scars behind. Those scars are more pain sensitive, less elastic, and unfortunately, they tend to actually flare up or become re-inflamed more easily. So this shockwave therapy, what this does is it sends a pulse, a sound wave into those tissues. And what that does for you is it uses something that your body is already doing, the process of breakdown and repair. See, every time we work out, we're breaking our tissue down. We tear the fibers. That's what allows us to allow, during the rest phase, for the body to go through the healing process, and it builds the muscle stronger and bigger. Well, what this technology does is it helps you do exactly that. You get to actually break that scar tissue down, but not allow the body just to heal on its own, because sometimes it's going to heal in a very random way, which is going to cause us to have all this scar tissue, this mesh that's there. No. What it does is it allows you to funnel or guide the healing process. giving it some guidelines so that your tissues are capable of repairing and actually restoring that better motion, getting rid of the inflammation, and getting rid of that pain. The wonderful thing is that this only takes minutes. It's an absolutely amazing process. And for many individuals, they experience a tremendous amount of pain relief in a very short period of time. And the awesome thing is that the process only takes a few weeks to walk your way through and complete in its totality. So I love the fact that, you know what, there are options out there. Because as your feet happen to be that foundation, we got to make sure that they're taken care of properly. Now, all this being said, the very first thing that we're always going to look at as chiropractors is making sure that those joints are moving properly. See, just like a subluxation in your spine, subluxations in your feet, because the arches haven't been supported, cause the bones to jam together. When they jam together, yes, it's going to produce pain, but since they're jamming together, that's going to produce arthritis. Because they're jamming together, the muscles have to work harder because they have to be recruited to make sure that you're still doing your 10,000 steps a day. By the way, since the arches are not being supported properly, you know, you're leaning more to one side than the other, which means one foot is actually having more stress, more pressure than the other one with every single step. Your chiropractic adjustment makes sure that those bones are moving properly so that that normal gait, that normal rhythm that you're supposed to be going through is capable of being maintained. And again, allowing for the body to heal the way it was designed to be, guided in that right, proper place. In fact, your orthotics are exactly that. They only support the body in that best possible place. If you've never seen an orthotic, I mean, this is one of those, you know, I've been wearing mine since I've been about 13. They go from shoe to shoe. And the remarkable thing is this product, simple, easy, it just slides into your shoe. You can transfer it from one shoe to the next. But here's the thing, and one of the really big mistakes that most people make is that they only wear it in one pair of shoes. Or they think, well, you know what, you know, it's Sunday, I don't have to put it in my dress shoes. Here's the thing, in the end, if the body's not being supported properly, you're weakening the body, and your body is going downhill, and that's not okay. You know, to me, one of those most important things is that your orthotics should be matching up with all the different shoe types that you have so that you're constantly being supported at that optimal level. See, in the end, I'm just going to tell you, the first thing that you need to do is to make sure that you're getting checked. And my first question for you is, who do you know that doesn't know what you know about the feet? And about making sure that their feet are functioning as properly as they should. So again, I'm going to remind you of the 3 things that we're supposed to do. Like this video. I want you to leave me a comment. I'm going to remind you, I respond to all those comments personally. Number 3, share this with your Facebook family. Share it with your friends to make sure that they have an opportunity of knowing what you know about how to make those better choices. I'm Dr. Joseph Baker from the Limerick Chiropractic Center. You have a great day.